Welcome to MS Research Australia's Research Report. This is the second part of an interview we recently had with Professor Gavin Giovannoni. In this part, he talks about some of his initiatives and campaigns to help improve the treatment of people with MS.
So the MS Brain Health Initiative, it's been going now, we launched it in 2015 essentially, so it's been going for 3 years. I mean, the real reason for doing it was because of the inequality or the variance in how MS is managed across the world. So we have some countries where it's managed extremely well, and we have other countries where it's managed very, very poorly. And the reason for that is usually financial. It's usually around very strict guidelines at a local country to try and restrict prescribing or saving money. And what we would like to highlight is this variation and try and activate communities to actually treat MS much more seriously than it is. And so it's all about how do we diagnose, treat early and treat actively to improve the outcome of MS at a population level. And so the idea is to give people the tools within their own countries to inform policy. That's what we really want to do. We want payers and the politicians to create the environment to treat MS like we treat stroke, for example. We're trying to do what happened in stroke, to go from passive, responsive type treatment to a very active, being proactive about it. That's what we're trying to do with it. Unfortunately, the policy document is what it is. It's just a document about how we should treat MS in the modern era. And the problem I've found is that information very rarely changes behavior. And so what we're trying to do in the next phase of the initiative is to get some nudge factor. And that's why we're creating an audit or quality improvement tool, so people can audit and look at their practice to see how well they're doing against the guidelines. And then we're going to create a patient checklist. So somebody with the disease can actually rate their service based on the policy document. In other words, are they being monitored properly? Are they being offered more effective therapies? Are they involved in shared decision making? Are they being advised about lifestyle issues? And I want to turn that into an app actually. And the app's going to be called MS Advisor, like TripAdvisor. So it'll allow people with the disease to give their service a good review or a bad review. And hopefully if the bad reviews come in, it'll prompt the healthcare professionals to think about their practice and change it. So it's trying to the term is participatory medicine. We want people with the disease to participate in their healthcare and hopefully nudge and improve services. We probably need some qualitative work to see how effective it is in changing practice. And so that will require some audits, essentially pre and post implementing the audit tool, for example. And so part of that quality improvement tool will generate data. Part of the Brain Health Initiative is actually collecting data. So it's actually databasing and having local information about your population of patients. And I think that in itself will drive up quality. As soon as people collect data about their patients, it's well known in other disease areas, it improves quality. So that in itself will help. And how we measure how that impacts on practice will require an international data collecting. Something like MS Base may be able to provide information for that. And then what I think we really need to do is we need to define specific projects that are linked to brain health around, for example, cognition, or how we make people aware that cognition is a big issue. I think that's that's the handle to get people to adopt the Brain Health Initiative, because cognitive problems occur very early in illness, often before people become physically disabled. And I think if we focus the MS community on the impact that MS has on cognitive function, they may treat the disease much more effectively. So I think we need a big drive on research in cognition in MS. Where do we stand with the role of vitamin D in multiple sclerosis? So I think there are two aspects to vitamin D in MS. There's three aspects actually. The question is vitamin D a disease-modifying therapy? And so that's an established disease, and I think the evidence at the moment is exceptionally poor. And even the trials that have been done at the moment are underpowered. So, unless we do a properly powered international study, we will have very little from these trials. I think these trials are unlikely to give us the answer. My argument, though, is there's a compelling reason why people with MS should be vitamin D replete anyway for bone health. And so that's why we recommend to our patients to take supplements. The more pressing question is, could vitamin D be a preventive strategy? And I think the epidemiology suggests it may be, but we need to do a trial, and that trial will have to be an international trial. And there's lots of unanswered questions about how we would do the trial. Should we target in utero, childhood, adolescence, or later? I personally think we should do vitamin D supplements across all of those categories. What dose to use? I think we should treat the target. People should be replete. And I don't know if we know what replete means. You can't use population levels because most of the population is deficient. And so we'd have to go to an evolutionary medicine approach and ask the question is what our ancestors have as vitamin D levels, what our outdoor workers have. And I think there the target will be above 100 nanomoles per litre. So there's all these questions to answer, but we as a community have been irresponsible, if I can say, for not starting prevention trials sooner. We should have been doing them already because this information about vitamin D being a potential in the causal pathway has been around for decades. And so, the MS community really needs to come together now, design a study, and get it off the ground. Well, I've got several campaigns. So, obviously, the brain health is one of them, and that's going very, very well. The other campaign is Think Hand. It's very important focus on hand function. Our worldview of MS has always been about legs. The EDSS, the disability score we use in trials, is all driven by walking, to be honest with you. And we need to really think about, even in people in wheelchairs, can we delay worsening or loss of hand function? Because if you've got MS and you're in a wheelchair, your hands are your legs in a sense. So losing hand function is a disaster for people who are in wheelchairs. And so that's why we've got to do trials in wheelchair users to try and protect or delay worsening of upper limb function. So that's the Think Hand campaign. Then there's the Prevent MS campaign, is can we get prevention trials off the ground? That's very, very important. But another campaign that I'm trying to get off the ground is MS is one of 2 or 3 diseases. And I think that's been one of the problems we have in terms of developing drugs for more advanced disease. The regulators, the European Medicine Agency and the FDA, require companies to do trials in 3 diseases: relapsing, remitting MS, secondary progressive MS, and primary progressive disease. And there's no data to suggest they're different. The reason why they separated them out was simply because of the Orphan Drug Act. When the interferon trials were done, the companies wanted to get the drug licensed under the Orphan Drug Act. And so to do that, you had to have less than 200,000 patients. And so what they lobbied the FDA is to accept that MS was 3 diseases. And so it was an artificial construct, and we need to now go back and change it.
It was great to be able to chat to Professor Gavin Giovannoni about his insights into research and also into his initiatives and campaigns. I'd like to thank him for the time he spent with us. If you want more information, make sure you go to our website, follow us on Facebook, and subscribe to our YouTube channel. I'm Dr. Hamish Campbell, and I'll see you next time.